Good day, class. In this video, we are going to start a new session, Differentiation of the Disease Nature. This session includes central differentiation of Qi disorders, central differentiation of the blood disorders, central differentiation of the fluid disorders, central differentiation of yin and yang disorders. At last, we're going to talk about the combination of these factors when they happen together. What kinds of manifestation does the patient have? Until now, we have introduced quite a few differentiation methods, including the eight principles and the etiological factors. From the study, you will see that from the differentiation, we study the manifestations. We try to use the basic theory to analyze these manifestations, analyze the clinical symptoms from the patient. And when in the basic theory study, we also study these factors, such as we have studied the wind in the exogenous factors, wind, the cold, the dryness. And then in this, something related to this session, we also have studied the function of the qi, the blood, the fluid, as well as yin and yang in the basic theory. So in the basic theory, we actually study these terms or these objects such as qi, blood. What's the function of these? Also, we have introduced what's the characteristics of the wind, of the coldness in the basic theory. And then from the differentiation in the diagnostics, we try to gather the clinical information that match the characteristics of those factors. And then we conclude to those factors. So we actually study the same or similar information, but just from the other way. Firstly, in the basic theory, we study from the medical terms first, and then we study the manifestations, what these terms, such as the wind, what kinds of manifestations does the wind have? So that's the characteristics of the wind. And then in the differentiation, we study the manifestations, what kinds of manifestations the patient have, and then we conclude to the diagnosis of the wind. Same as here. When we study the disease nature, different disease nature, it actually refers to, you don't need to write about the title of disease nature. We mainly focus on the qi, blood, fluids, and yin and yang disorders. So in order to talk the qi disorders, we need to revise what's the qi's function and why it is so important for qi in our human body. So qi got different functions, such as the confining functions, such as the warming function. So these are some of the functions of the qi. And in order to perform these function well, or in order to perform the zangfu organs function well, qi, firstly, we need to have sufficient qi. So that's in terms of the volume of the qi. Although we can't test from the lab, that's how many moles or how many grams qi we need per person. But just in general, that's why it's regarding the volume, sufficient or not. The other part is the movement of the qi. When we study the qi theory in basic theory, we have spent quite a few time to talk about the Qi, the Qi, the movements. So in order to perform well the Zangfu organs, firstly, we need to have sufficient Qi in terms of the volume. Second, the Qi movements should be smooth. So when you see the Qi disorders, you will see different tones or different manifestations that falls in different category of the Qi disorders, such as Qi deficiency, Qi collapse, or Qi counterflow. You see different tones there. When you see the categories or when you see the cause of these conditions, you will understand that mostly we focus on the volume of the Qi. Is it insufficient in terms of the volume? The second is the movement. Is the movement smooth? So for similarly to the blood and fluid, we also focus on these two categories. So that's how to help you to remember or to memorize better or easier. When you see from the notes, you will see many different symptoms. How do you remember them? You put them in categories, such as with the Qi disorders, the volume. There are four different symptoms. These four symptoms are all related to the volume of the Qi. They have different terms, different names. The reason of them have different names, so because from the names we can see how much Qi the patient has, such as the Qi deficiency, Qi sinking, Qi insecure, Qi collapse. So these are all. There's another theory, Qi stagnation, Qi counterflow, Qi blockage. So there are 7 symptoms of Qi disorder. From these 7 symptoms, you can put it into two categories: the Qi deficiency and Qi collapse. These two are the symptoms due to the volume of the Qi. Qi sinking, Qi insecurity, Qi stagnation, Qi counterflow, and Qi blockage. These 5 are due to the movement of the Qi, the abnormal movement of the Qi. So similarly to the blood disorder, you also can think about these two. The order in the blood disorder, the textbooks already gave us 2. One's deficiency pattern, one's excess pattern. These 2, the blood deficiency, the blood collapse, already refers to the volume of the blood, and then the blood stasis, blood heat, blood cold, it's kind of movements, but not actually the movements. Sometimes the heat and the cold can affect the movement. Although we try to put these different symptoms into 2 categories to help you to remember, but sometimes just need to keep in mind that the volume and the movements, they also happen together. So you also can't separate them. The reason is if in one person, if they don't have enough volume of the Qi movement also going to be affected. So there will be no way that in that person they got Qi deficiency or Qi collapse. And then on the other hand, that's the movement of the Qi move very well. So this situation is kind of impossible. That's why sometimes they happen together. The Qi disorders, the first one we are going to introduce is the Qi deficiency. The Qi deficiency, from the term, we can understand that the Qi deficiency is kind of a lack of the Qi. The Qi deficiency just means we don't have enough. So you can see from the category, from the textbooks, these four terms falls under the category of deficiency syndromes. So these four refers to Qi deficiency. Qi deficiency due to the insufficient yuan primordial qi. So if the patient or the person has not enough qi, it will affect the qi function. What function does the qi has? The promoting function, the confining function, defensive function, transformation function going to be affected. So in this situation, the patient can present with different manifestations. Mostly or most commonly, the patient can present with short of breath, fatigue, weak or deficient pulse. So that's the main or the most typical manifestations of a Qi deficiency syndrome. And then how do we remember or how do we understand these manifestations? You just need to think about what's the Qi function. Otherwise, in other words, if the patient have sufficient Qi, what's going to happen? The breathing will be normal. The patient will be talkative. There will be no fatigue. The pulse will be forceful. So when there's no enough Qi, insufficient Qi, when you see the manifestations, especially for the key points, there are different manifestations, but these different manifestations, the cause, or when you see these manifestations, you will see that all these manifestations are the same manifestation in different organs or in different aspects, such as shortness of breath. Why the patient will be shortness of breath? That's because the breathing function is weak. That's why they don't have. They always feel short of breath. So that the breathing function is weak, or the lung has no enough energy to breathe. That's short of breath. No desire to talk. This we have mentioned quite a few times in the previous text. We, especially from the textbook in the previous slides and test, it also sometimes said reluctance to talk. So these two understand why the patient will present with reluctance or no desire to talk. Because they don't want to speak. Why they don't want to speak? Because they feel tired, fatigue. So fatigue in terms of speaking, they feel too tired to speak. That's why no desire or reluctance to talk. Mental fatigue, we already used the word fatigue. Lassitude is the physically fatigue. They don't want to move, they feel tired. A deficient pulse, weak pulse. That's the pulse also weak. So as you can see from these different symptoms, from the breathing, from the talking, from the mental activities, from the physical activities, and the pulse, all these different manifestations. When you see behind these manifestations. These are just because of the tiredness of fatigue, the tiredness of breathing, the shortness of breathing, the tiredness of talking. That's why they don't want to talk. Mental fatigue, they don't want to think, they don't want to move. The pulse also weak, the pulse doesn't want to beat. So all these manifestations are due to Qi deficiency. And that's because why Qi deficiency will have these manifestations. That's because the Qi has the function of promoting what? That's promoting the circulation, promoting the Zangfu organs, promoting the breath, the breathing, promoting the talking, promoting the physical or mental activities, promoting the pulse. So these, in order to function well, what do we need? That's the Qi's function. So these are Qi deficiency. There's one more aspect that's very important for Qi deficiency. Thus, these symptoms, these manifestations will be aggravated upon movement. So the patient already feels short of breath. The patient already feels reluctance to talk or fatigue. Where they move, they feel worse, which means the patient, if for instance, in our daily practice, the patient can feel short of breath after walking for 10 meters. The patient will feel short of breath after talking 10 minutes. The patient feel tired after, such as after the class, one period, 45 minutes of the class. So the manifestation or the symptoms will aggravate after movement. That's also a very typical manifestation of Qi deficiency. The reason for this is because the patient don't have enough Qi. When you move, we require more Qi to perform the function, but you don't have enough. Now we require more. That's why the these manifestations, the patient will feel worse. So this is very important kind of key points for Qi deficiency. Patients suffer from Qi deficiency also can result in the other, especially the other pathological products or the other conditions, such as blood deficiency, the fluid deficiency. That's because the relationship between the Qi and fluid. Qi deficiency also can result in dampness, phlegm, water retention, Qi stagnation, blood stagnation. So those we're going to talk later. From these relations, from this relationship, you're only going to learn from the relationship between Qi and blood, and also some of the manifestations here. Qi deficiency. The patient feels dizziness. Why the patient will feel dizziness? That's because you don't have enough Qi. The Qi doesn't go to the head. So when you don't have enough Qi, sufficient of Qi, the Qi will stay in the body, in the organs, in the heart, in the lung, in the spleen, stomach, and kidneys. You don't have enough Qi to the head, so you feel dizziness, you feel blurred vision. That's because of Qi deficiency. Spontaneous sweating. Why the patient will have spontaneous sweating? That's because of the function, the confining function of Qi. Qi supposed to stay at a superficial level of the body to control the body fluid in the body at a superficial level. Now we don't have enough qi. The qi deficiency will cause lack of body fluid, spontaneous sweating. The wind intolerance and common colds. That's because defensive qi, the function of defensive qi. So from the study in the qi in the disorders of the differentiations of disease nature, similar to the previous one, you also need to learn how to explain the signs and symptoms. Although now we use online lecturing and especially for the explanation, if you write a test, you will be asked how to analyze, how to understand these symptoms from the theory. So in a test, if you were asked to explain the symptoms, if you write Qi deficiency, the patient may present spontaneous sweating. That's not enough for your marks. You need to tell me spontaneous sweating. The cause of spontaneous sweating is because the qi lose the function of confining function. That's why the patient will present with spontaneous sweating. Why the patient will present with dizziness. So the manifestation, this kind of statement is not enough. What's important is the explanations through the theory. Qi thinking is also, it can be lack of qi, but with the manifestation also presents as the movement. So this is the combination of the movements and the volume of qi. Because qi have the confining function to keep everything in certain position. That's the function of the qi. So especially for spleen qi deficiency, spleen qi sinking, this will manifest as spleen qi fading to ascend. That's the ascending function of the qi. Qi fading to ascend, you will see what's the manifestations. Something in the head, dizziness, blurred vision, tinnitus, mental fatigue. So these are something in the head. This is very similar to the qi deficiency. Thinking. Do you think that the qi thinking, this kind of person will have sufficient qi? If they have sufficient qi, the qi won't sink. So it can disperse all over the body. So the qi thinking mostly also combined with the qi deficiency. The qi thinking, when the qi sinks, move downwards. So in the head, in the top part of the body, we don't have enough qi to nourish these areas. That's why the patient will have dizziness, blurred vision, tinnitus, mental fatigue, short of breath. And some of you may ask, these manifestations that we can see from the qi deficiency, how do you know that's a qi deficiency and this one is a qi sinking? So those are very good questions. Qi thinking, we not focus on these aspects. The patient may present with all these manifestations, but in order to diagnose qi thinking, you need to focus on qi fading to ascend. When the qi fading to ascend, spleen qi fails to ascend. What happens? Especially for the internal organs. prolapse of the internal organs. It can be the rectums or uterus. This condition, most of the patient can be like skinny and tall. From the inspection, the Qi fails to hold the organs in certain position. So the patient may present with typical Qi deficiency syndrome plus the collapse of the internal organs. So that's Qi sinking. Also need to be careful that the Qi deficiency, although we mentioned those manifestations, we didn't mention the tongue manifestation in Qi deficiency. What kinds of manifestations can the patient has in Qi deficiency? Most of the condition it will present with pale tongue, enlarged tongue. Why enlarged tongue? That's because from Qi deficiency, it can result in water retention or dampness. That's because Qi deficiency in the body also includes the spleen Qi deficiency. The spleen Qi deficiency will result in water retention in the body or the dampness in the body that can result in enlarged tongue and paled tongue. Qi sinking, Qi insecurity, and Qi collapse. These three different syndromes mostly are based on the Qi deficiency. So it is actually developed from Qi deficiency. The reason why we have different terms for these is because these different syndromes becomes more and more severe in the manifestations, and it also become more and more severe in terms of the Qi function. The Qi function is weaker and weaker. That's why we give them different terms. The Qi insecurity refers to Qi failing to secure the axons, blood, and body fluid. So this term is also from the confining function of the Qi. The manifestation can be spontaneous sweating. Why the patient will have spontaneous sweating? That's also because of the confining function. The Qi need to secure the body fluids. Bleeding. The Qi need to secure the blood in the body. Bowel and bladder incontinence. Nocturnal emissions. Premature ejaculations. So this from men's problem. Insecure, that's why it comes earlier. Miscarriage. Miscarriage is also because of the Qi insecure. That's why the baby, the fetal, comes earlier than it's supposed to. Metastasis. This term might be funny to you, so this you can use the other term, such as it just refers to the excessive bleeding in ladies in the period. So it means bleeding a lot in a period. These are different terms. When you see these different manifestations, it is also similar to the Qi deficiency. It's just different manifestations in different organs from the same reason. Qi, the function of Qi, the confining function, the Qi is supposed to secure something in somewhere, but now the Qi loses the function of secure something in somewhere, such as the spontaneous sweating. That the Qi need to secure the fluid in the body. Bleeding, the Qi need to secure the blood in somewhere. Miscarriage, the Qi need to secure the baby in somewhere. The excessive bleeding in the period, also the blood should not come out that much, but it comes out that much, too much. So that's the insecurity function, plus Qi deficiency symptoms. So as you can see from here, Qi deficiency, Qi collapse, the next one, Qi sinking. All these three syndromes, they all will have Qi deficiency symptoms. And why they got different names? Because they got different manifestations. Typically, because the security function or the confining function of the Qi, they lose the confining function of the Qi. The Qi cannot secure the body fluids or other aspects in the body. So these are the key points of this manifest of the Qi insecurity syndrome. Qi collapse. Qi collapse is a critical condition of the Qi disorder. Extreme fading of Qi, which means we don't have Qi, or we have only a little bit. In this condition, the Qi will lose its function. What kinds of function will, when we don't have Qi? Persistent sweating, cold lumps. Why will they will be cold lumps? That's the warming function of the Qi. When we don't have enough Qi, so the body don't have enough heat in the body. That's why it presents with cold lumps. Pale complexion, Qi deficiency. It can be irregular breathing, the severe condition, unconsciousness, or sudden collapse, also severe condition of Qi collapse. When you see the description of persistent sweating during any bells, where we have mentioned the persistent sweating, we mentioned in somewhere. You can go to the yin and yin depleted, yang depleted. So that's Qi collapse will accompanied with yang depleted or yin depleted. So the persistent sweating, the sweat also very different from the normal sweat. So this sweat is not this sweat is not the same as the spontaneous sweating. This sweat can be oily sweating or sticky sweating. So thus you also can refer to the inquiry of the sweating. We have mentioned different sweatings in that session. That's from the Qi collapse. The key point is very, very, very weak pulse. Fainting breathing. Patient may present with consciousness problem, persistent sweating. So that's the Qi collapse. So as you can see from Qi thinking, Qi insecurity, and Qi collapse, these three, all from the Qi deficiency. These four, Qi deficiency, Qi sinking, Qi insecurity, and Qi collapse. These four symptoms, they actually develop on the previous one. It also indicates a more severe condition from the previous one. So the Qi sinking is worse than Qi deficiency. Qi insecurity is even worse than the Qi sinking. Qi collapse is the worst condition of the Qi deficiency symptoms. Although we cannot see the level of Qi in our human body, but we can see the manifestations, such as now our office in the 7th floor, or our lecture hall in the 6th floor. Some of you, when you walk upstairs from the stairs, not from the lift, you walk from the ground floor to the 6th floor. Some of you will feel short of breath, but some of you still feel fine, not too bad. So in this situation, though you can help you to identify among the students whose qi is sufficient in individuals. And also you can see some person, they have Qi deficiency. You also can think about who, but not from the students, because from students you can't see that clearly, because all of you or most of you are very young, and you always have enough Qi. But you can see some other people from university. You can see when they walk upstairs, some of them, they will feel short of breath, and that kind of person, apart from the age, you see the appearance. Most of them who feel short of breath when walking upstairs, they also may not have to, they also may be obesity, so kinds of fat. This situation also linked to Qi deficiency. So in Chinese medicine, we think that obesity person is more likely to be Qi deficiency. That's something we can see from our daily life. An obesity person, when they walk long or when they walk upstairs, they always feel tired. That's the fatigue, as we mentioned in Qi deficiency. Tired or fatigue become worse after movements, after walking long, or after walking upstairs. They feel worse. They feel short of breath. That's the manifestation of Qi deficiency. So that's something you can see from our daily life. You can see something around you. Try to use these differentiation method to apply to the daily life, because we study human health. You can see many manifestations around you that you can use this theory to analyze. You don't have to analyze on patients in the clinic only. Everyone, your classmates, everyone around you can be the target for your analysis. For you, they also can be the very good examples or samples for your practice. Thank you for your attention.